Good morning. So I know this is a nursing vlog, but I am going to film it while I'm on my hike this morning because there's construction in my house and I just won't get to this video later if I don't do it now. So it has been a month this coming week since I've transitioned from being a bedside nurse to a nurse practitioner, and I'm still working my bedside job, if you didn't know that. And I've learned a lot becoming a provider, and honestly, my nursing bedside experience has helped me tremendously. I now go to like admin meetings and I feel like I'm able to vocalize my concerns because of having that bedside nursing experience. And it has also made me a better bedside nurse because now I'm learning more things and about like just treatment plans and stuff, which I also wanted to mention that I did go on to an online nurse practitioner school, and I'm going to mention that because I feel pretty confident in my transition. Like, I'm not scared. I don't question my judgment on when it comes to treatment plans. And I just want to mention that because I do see a lot of comments on sites that discourage people from going online because they say like you won't be as good, which I can kind of understand because, to be honest, I think in-person learning is the best. But in this day and age, you have to do what you have to do. I worked full-time the entire time I went to school, including clinical. It was really rough, but I think people discount that you won't be as good as an online, which, like I said, I can kind of understand where they're coming from with that. But I don't think that me going online hindered my education or how good I am because I went online. But so things that I have learned. One, it pays to have a good nurse. It really does. Like, I realize how much not being able to trust your nurses can make or break your day. And I work on a trauma and SICU position. So sometimes I'm on our trauma floor, which means I take all the patients throughout the hospital. And sometimes I'm on SICU, meaning I am just solely in the surgical ICU. So a little mixture of things, not just trauma. But I've learned, like, one, I've never been a floor nurse. Like, I've worked heli, I want to say maybe 2 to 3 months in my career because in order for me to get ICU trained, that was like one of the stipulations that I had to do at this hospital that gave me my ICU training. So I don't have a lot of experience on that, like med-surg tele units. And because of that, in the ICU, I only see like people at their worst. I don't see when they get better. I don't know when they go home. I don't know the process of getting out of the hospital. So people actually always ask me, like, once their patient or their family member is like stabilized, they ask me like, okay, so where do we go from here? Like, how much longer are they going to be in the hospital? And as a bedside nurse, I'm always like, I don't know, because I don't see that side of things. I only see the worst of the worst. So now that I'm a provider and I'm on the trauma floor and seeing people on med-surg heli, like PCU, DOU, whatever you want to call it, now I get to see that end. And I like it because now I can actually, as a bedside nurse, like answer those questions to these family members. And there are things like every hospital is different, clearly. Every hospital has different rules. And like the other day I was just charging a patient who had a PICC line and it needed to come out. And I was like asking the person training me, like, do I need to go physically remove this myself? Do they have a team? Will the nurse do it? Like, worst case scenario, I don't want this patient going home with a PICC line. Like, that would be horrible. I don't want to be responsible for that. And now that I'm a provider and now that I can get sued, it's something that terrifies me. Like, will this nurse know to take it out? Like, and I'm not trying to undermine this nurse's education or anything like that, but like, I don't know, I'm new to this, and I just want to make sure, because people do go home with PICC lines, so I just want to make sure that this particular person made sure that they got it removed. So I really realized how much, and talking to other doctors who like I personally work with as bedside, expressed to me like during COVID with lots of travelers and you don't know, your staff anymore, like it was worrisome, it was scary. So yeah, I realized that having like trusting your nurses and having a really good nurse is like really, really important. Another thing I find very important, and something that is extremely important to me, and honestly this is dictated where I've worked, like I've left jobs because of this, but having a nurse provider relationship, a good one, is also something that is so valuable to me. So I personally, as a bedside nurse, love when providers are willing to teach me things. Sorry, my hands are getting tired so I keep moving the camera. I love when they're willing to teach me things. I love when they're willing to explain to me why we're doing what we're doing, just for my like education. And I love feeling part of the team. I love feeling part of the plan. So I really value doctors, providers, who take the time out of their day to look for me when I'm as a bedside nurse and ask me like, how did the patient do overnight? Do you have any concerns, or do you need anything? And I really value that as a bedside nurse. Like that is one reason why I love my current bedside nursing job so much, because all the doctors that I work with do that, and I love and appreciate that so much, and I feel like we have better patient outcomes because of it. And so now that I'm a nurse practitioner and I'm going to see these patients, I make it a point, and it's really hard because there are so many floors, so many nurses, but I try to make it a point to always go, and like when I round, I'm rounding really early, like I'm rounding before shift change. So I always make it a point to go and find the night nurse and ask them like, hey, introduce myself. What is your name? Try to get to know them and say like, hey, I have this patient. Do you have any concerns? Do you have any, do you want anything, like any orders, or like what do you feel like what happened overnight? And I try to do that because of the fact that it means so much to me. Whew, it's getting harder and harder as I'm climbing up this hill. But another thing that has been a little stressful is nurses who give you kickback or attitude. And I'm the type of person who really values a healthy work environment. I am not the type of person to be sassy. I can be a very sassy person, but I choose to make it a point not to at work. And so now that I don't know, these nurses or staff members, one, nobody ever believes I'm the provider. Every time I walk in a room to go see my patient, I'm always asked if I'm the night nurse or if I'm PT or OT. Like nobody says like, hey, are you the nurse practitioner? Nobody. It's kind of comical to me because that's like the last thing they think of. But it's okay. It's all right. It's kind of funny at this point, but it is so beautiful out here today. Yeah, so because of that, I find that some nurses, if they don't agree with your treatment plan, not all, but some can be very rude, and some, I don't want to say like are lazy, but wow, like the attitude that I've gotten in 4 weeks from like 1 to 2 nurses about the simplest little things, I was shocked. Like I ordered a stat MRI and a C-collar to be placed on a patient, and this nurse yelled at me and was like, you make our life so hard. And I was like, what? Like, 1, how hard is it to get a C-collar? 2, you don't even go to MRI. The patient's like ambulatory. What's the big deal? Like, I could not believe, even as a bedside nurse, like that is not something that I would complain about. So I don't understand why this nurse felt the need to yell at me like and express this to me, because I was like, I'm still a bedside nurse and that's not something that I would be upset about. But okay, to each their own. A question that I was asked by a friend was, does it bother you now as a bedside nurse that you know what a patient needs and you don't get it from your providers? And I kind of, it doesn't. Like, I have always respected the workflow and the decisions of the provider. Not every doctor is going to prescribe the same thing. Not every doctor is going to agree with you. And I 100% like believe in that. And every provider manages very differently. So even as a nurse, like even if I didn't agree, like I'd still have to do it. They're the doctor. But now that I have a little bit of experience in treatment plans and stuff, it's annoying that my dream would literally be to be able to take care of my bedside patient and put my own orders in. Like, that would be amazing, but I know that's never going to happen. But I like learning from other people. So even though I know I have the ability and the capability to make decisions when I'm a bedside nurse, I respect my boundary as a bedside nurse. I 100% will not cross the line just because I'm an NP now. Like, I know my limits and my scope of practice in each role. And that's one thing that my new job has stressed to me, is that when I'm at work as a provider, I need to abide by that and not overly help in the sense that I know I can as a nurse. And I'm not gonna lie, it has been a little bit of a struggle, because when I'm walking in the halls to go see my patients as a nurse practitioner, there'll be patients who are screaming, help, help, or hey, like recently, I just had a lady ask me, like I was standing outside the door rounding, and she was like, excuse me, can you put my head of bed down? Not my patient, not in my service. And I was like, the bedside nurse inside me wants to go help her, wants to go put her head down. But what kind of patient is this? I don't know. Whose service is she on? I don't know. So I can't just walk into the room and lower the head of the bed for her, because I don't know her restrictions. I don't know what kind of injury she has. I don't know what type of disease process she has. Some people need to have the head of bed above 30. So those are things that I have struggled with, like knowing when not to step in, realizing that this person is not on my service. And now if I go in and help and I get hurt, or the patient gets hurt and they're not on my service, like I'm responsible, I'm reliable, and I can't do that anymore. And the natural nurse inside me struggles with that, because I'm not the type of person to hear a patient scream or call out and just walk by, or be like, I'll grab your nurse, like when I can simply just do it. But I don't work there as a nurse. Like, I can't just do that. I don't work on that floor. I don't work on that unit. I don't know the staff members. I can't just be like, yeah, I'll grab the nurse. I know where she's at. I don't know. So that's definitely another thing that has crossed. I mean, I don't think people will struggle with this if they're not keeping both jobs at the same time. But since I am, I really have to learn my boundaries, like in scope of practice, when I'm in each role. This coming week, I'm in the SICU. I'm so excited because ICU is my bread and butter. It's where I feel most comfortable with. It's where I know, like, if shit hits the fan, I know all the meds and all the drugs, like I know all the equipment. So I feel much more comfortable in that element. When I'm on trauma and I'm on the floor, it's like I don't really discharge. I've never really discharged as a nurse. So I'm like discharging, setting up the medication, sending them to the right pharmacy, like all that stuff is not something that I'm used to. When is it okay to go home? Like, working with social worker and case management in a different way is like a little nerve-wracking to me. Like, can I send this person home if their walker's not delivered yet? Like, will it be delivered by the time they get home? These are questions I've never had to ask myself. So those are another thing that's like new to me. So that's why I'm happy to just go back to the ICU where I don't have to worry about that stuff. But another thing that I realized, like, my confidence level as a bedside nurse has also increased, in a sense that I feel like I've had internal panic when like something goes wrong. Like if your patient randomly starts like declining, you have to stop and think like, okay, what's going on? What's happening to my patient? And sometimes I used to have a little bit of panic inside me and be like, oh shit, okay, what's happening? Like, what do I do in this situation? Okay, like, airway, breathing, circulation, like what is causing this? You know, like your H's and T's. And just yesterday, I had a patient at literally change of shift. Husband was like, hey, she's not feeling well. Can you please come and look at my wife? And I was like, sure. And I was like, I see this patient's clearly decompensating. And instead of like having that internal panic, I was able to like step back, analyze the situation, get the help quickly. 15 minutes later, stable, back to normal. And I was like, like I'm proud of myself because I didn't have that internal like fight or flight mode. I was like able to maintain my calm and like choose, okay, I know what causes this. Let's check all these boxes and go from there. So yeah, that's been another really exciting part of this whole journey. So I've been asked, how do you like it? I like it, but do I love it? Not yet. And I'll explain why. I love, more than anything, being an ICU bedside nurse. It is everything to me. But I was never ready when I became an NP to give up bedside. I was not burnt out, still not. I never intended to leave bedside. And I did this because one, I was motivated to, two, I had a bunch of interns who made me feel smart enough and like gave me the confidence to go ahead and do it, to further my career. So I did it, and I'm proud of myself for that. But I wasn't like ready to give up bedside. And because of that, the provider role is completely different. Like being a nurse practitioner is very different than being a nurse. And I like being a provider. I don't love it totally. Like I like being able to pick my own treatment plans, dictate what happens with the patient, like how this is going to go, and see what outcome happens, right? But I hate writing the notes. Like, I don't like that part. I don't like the fact that I don't get a lot of time with the patient. And that's the part that I love so much about my job. I love being bedside. Like, I love being there to comfort them, to help them heal, and like to see them get better. And that's the part that I struggle with loving being a provider, is the fact that I'm only there for a little bit. The rest of my work is, I feel, more behind the scenes, like looking at labs, looking at meds, like looking at the diagnostic exams and like all that. And that is done in an office. Like, that is done at a computer. It's not done at the bedside. And because of that, like, that's what I struggle with internally, to love the job. Another, like, I don't want to say issue, but another thing that I have been able to adjust to is, like, I have an attending. I work at a teaching hospital, so there are ranks of who to go through. And because of that, like, the only hard time I'm having adjusting to, besides like the little nitty-gritty details of like who to call for what, is when can I do things on my own versus when do I have to tell this, like, an attending? When do I have to get it approved by the attending? Like, I don't want to overstep my boundaries. And then every attending has a different, method and way that they go about things. So it's like, I have to learn my attendings and all of their personalities, their attitudes, like how they work. And I have not learned that yet in a month. And go from there and see, like, when, on whose shift, like on whose watch can I do my own thing, and when do I have to actually ask to do things. So those are little adjustments that I feel 100% like I can do, and will learn eventually. not everything's gonna happen overnight. I have to be patient. Another thing I'm super excited for is that I went to school because I wanted to intubate and place lines and like suture and do all that stuff, and it's coming. Like, we're gonna be learning soon, so I'm beyond excited for that stuff. I feel like once I actually kind of get adjusted to the flow, to learning the little nitty-gritty details, I will be 100% more confident and probably fall in love with the job. But as of right now, I'm still like, it's only been a month. I'm still getting my feet wet. And right now, still, I love my ICU bedside nursing job more. Like, it's my heart. Like, that's what I became a nurse for. So yeah, thank you guys so much for watching this video. If you have any other questions, tips, tricks, leave them down below, and I'll see you on the next one. Bye!